Hi, welcome back to my channel. Happy Vivian. Hi, how are you today? I hope everyone always with good health and always happy. In this video, I would like to talk about the mental illness. Some people ask question, can we diagnose mental illness by ourselves? The answer is no. Although it's great to be aware of your mental health and actively, but you should not attempt to self-diagnose a mental illness by yourself. Reaching a diagnosis can be a complex process, especially when you exhibit symptoms associated with numerous of mental illness. Determine which mental illness you might have. Eventually, if you want to be officially diagnosed with mental illness, you need to go to meet a doctor or therapist. They'll ask you some questions and use their training and experience to determine whether your symptoms match a particular mental illness. If you can try to meet with someone who specializes in mental health, like psychiatrist or therapist. But your regular family doctor can diagnose common conditions like depression and anxiety. They can also refer you to a specialist. Many people who have mental illness do not want to talk about it, but mental illness is nothing to be ashamed of. It is a medical condition just like heart disease or diabetic, and mental health conditions are treatable. We are continually expanding our understanding of how human brain works, and treatment are available to help people successfully manage mental health condition. Mental illness does not discriminate. It can affect anyone regardless of your age, gender, geography, income, social status, race, or other aspect of cultural identity. Which mental illness can occur at any age. 3/4 of mental illness begin by age of 24. The symptom of mental illness. If you feel like feeling sad or down or confusing thinking or reduced ability to concentrate, sometimes like we thinking too much, confused something that we don't know, excessive fear or worries or extreme feeling of guilt. Like someone sometimes like worries about something that we don't know, right? Just excessive worried. Extreme mood changes of high and low, withdraw from friends and activities. For example, suddenly some people doesn't want to talk with friends or suddenly lock themselves in the house. This is a symptom of mental illness. Significant tiredness, low energy or problem sleeping, detachment from reality or delusion, paranoia or hallucination, inability to cope with daily problem or too much stress. Also, this refer to the mental illness as well. Trouble understanding and relating to a situation and people. Problem with alcohol and drug use is very risk to get a mental illness. Major changes in eating habit or eating disorder, sex drive change, excessive anger, hostility or violence, and sometimes the people thinking like wanted suicide or suicidal thinking. Cause of mental illness in general are thought to be caused by variety of genetic and environment factor. Inherit traits. Mental illness is more common to people whose blood relative also have a mental illness. Certain genes may increase your risk of developing mental illness, and your life situation might trigger it. Environment exposure before birth, exposure to environment stressor and inflammatory condition, toxin, alcohol, or drugs while in the womb can sometimes be linked to mental illness. So if you are pregnant, maybe avoid to drink alcohol or using drugs, because if the baby just born, maybe just linked to the trigger to be mental illness. Brain chemistry. Neurotransmitter is naturally occurring brain chemical that carries signal to the other part of your body. While the over 200 classified form of mental illness, the 6 major categories of mental illness are anxiety disorder, including panic disorder, obsessive compulsive disorder, and phobia, a phobia for high place, or phobia with a snake or something like that. Eating disorder, personality disorder, post-traumatic disorder, psychotic disorder, including schizophrenia. Treatment for mental illness. Mental illness can be treated. I said yes. This means that many people who have mental illness and are treated recover well and even completely. However, because there are many different factors contributing to the development of each illness, it can be sometimes difficult to predict how, when, and what degree someone is going to get better. Treatment means for mental illness, all the different ways it can be. It can involve psychological therapy, medication, community support program. This support program might include information about the mental illness and the symptom, and then accommodation, help with finding suitable work, training, and education. Psychosocial rehabilitation and mutual support group, understanding and acceptance by the community is also very important for the mental illness. So mental illness doesn't improve by their own, and if untreated well, mental illness might get worse and over time and cause serious problem. So if you have a symptom that I mentioned before, you can see your primary care provider or mental health professional, because if you feel like worrying or fear or very excessive sad or low or really down, so you don't panic, just go to see mental health professional so you can be treated well. So thank you for watching, guys, and hopefully this is help for your information about the mental illness, and I will explain more about another symptom like bipolar, like another mental illness. Okay, and see you in the next video. Don't forget to subscribe and